It's a privilege today to welcome our next speaker, Tania Farha, CEO of Safe and Equal. Prior to joining Safe and Equal, Tania held various executive positions across the Victorian Department of Justice and Community Safety and Premier Cabinet, including as CEO of the former Office of Prevention and Women's Equality. Tania worked at UN Women for over 4 years as a policy specialist in the Ending Violence Against Women section and working for Victoria Police over 9 years to improve its responses to family violence, sexual assault and child abuse. We all know too well family violence is getting a lot of attention in the media and the public domain at the present time, regrettably as a consequence of the significant number of women who've been murdered by their partner, former partner, in the first 5 months of this year, which is totally unacceptable, and the impact that it has on children and all families and the intergenerational trauma that creates. Whilst in the sector we know that family, domestic and sexual violence is prevalent and has been demanding attention for numerous years, with the Prime Minister declaring the issue of family and domestic and sexual violence a national crisis, this creates opportunities for hope. In his press conference the other day, he did reflect that this was also a crisis that the Commonwealth Government cannot tackle on its own and be looking to other states and territories as well as other key stakeholders to deliver a response. And I know that those conversations are ongoing in every state at this present time. Being here in Victoria, there was a significant Royal Commission into Family Violence held in 2016. We had invited Tania Farha, CEO of Safe and Equal, to reflect on the topic, family violence reform in Victoria, still leading a light or fading embers. Please join us in welcoming Tania Farha to the stage.
Good morning, everyone, and thanks, Leanne, for that nice welcome. And obviously, thank you to the Family Relationship Services Australia for the invitation to speak here today. I'm not sure I'm going to get to the fading embers bit too much, but I'll certainly give my reflection. Can I also add to the acknowledgement that we're all meeting today on unceded Aboriginal lands, Wurundjeri Wurrung country and Bunurong countries, and I want to express my gratitude and respect to any elders past and present for their continuing connection to care for land, water, community and culture. I'd like to also acknowledge the incredible strength of Aboriginal and Torres Strait Islander people, their work on community-led solutions to prevent family violence in their communities, and extend any respect to First Nations people here today. Can I also recognise all victim survivors of family violence, including those that are here today, those who are still experiencing violence and those who are no longer with us. I won't reintroduce myself, you've heard who I am. Safe and Equal, for those of you not Victorian, we're an independent non-government org that represents the united voice of our members. I think some of you here will be our members, so really nice to see you all. We work for and with all our members, and we hope to deliver meaningful long-term change for all people who experience family violence. I'm going to be really talking today about all we've achieved to date, but I'm doing this in a difficult time when we've seen so many women killed, including here in Victoria. But these are just, of course, the women we're counting. We know that there are many more murdered and missing women that are not counted, particularly from Aboriginal and Torres Strait Islander communities. We've also yet to acknowledge the significant impact these deaths and others have on children and young people. And I think this is still yet to be assessed, and we haven't yet formed a mechanism to count the deaths of children, I think, according to, in conjunction with family violence. So I think we've got a long way to go before we actually have everyone in line of sight. But I think many of us who've worked in this area over the last 8 or longer 10 years or so, or even more in my case, in Victoria, we know that we've come a long way. And I think whilst we haven't fixed the problem by any means, we're doing a lot better. So I hope that we can hold on to that as we move into a discussion, I guess, of what's changed or what's been achieved, but also what needs to still be done. So over the last 8 years in Victoria, I guess it's been like a time not yet known amongst a sector or a group of services. We've seen unprecedented reforms We saw the government commit to 227 recommendations that emerged from the Royal Commission into family violence. I was going to just leave some time at the end for some questions because it's going to be impossible for me to cover the extent of the reforms here, but also the things that you might particularly be interested in. So I'll leave some time at the end for questions. A little bit about a bit of background, I guess, on Victoria's family violence system prior. During the time before the Royal Commission, the Victorian family violence system was guided by several key state-based frameworks. So we had Victoria's plan to address violence against women and children, the Women's Safety Strategy, the Victoria Police Code of Practice for the investigation of family violence, the Common Risk Assessment Framework, known as the CRAF. I should say in the two, probably from 2000 to 2010, there had been some extensive work done in Victoria, particularly instigated by Christine Nixon in Victoria Police, and I think Victorians will probably remember that time. She really made a commitment reforming Victoria Police, but in doing so really brought together all the other parts of the sector to try and work a collective approach. So we had, I think, a bit of a head start prior to the Royal Commission. Between 2010 and 2014, we saw some very high-profile sexual assaults and homicides that left the community shocked and demanding change, and this included, of course, the tragic death of Luke Batty, who was murdered by his father in broad daylight on a suburban cricket pitch in Melbourne. And this was following years of family violence perpetrated against Luke's mother, Rosie. And I think that we all agreed the system really failed to protect them. And in the aftermath of this tragedy, and we've seen so many others across the country, Rosie stood up and I guess joined the calls of many strong advocates before her to do something about this. And I think hers and Luke's story obviously struck a chord with Australians, and it really helped to change the conversation, not just here in Victoria, but across the country, I think. During that time, of course, there was media and community focus, probably unprecedented at that time. Of course, we've just seen another spate of that, and I think it helped start the enormous changes we saw. And this obviously all culminated in Victorian Premier Daniel Andrews' decision to call a Royal Commission into family violence in 2015. You know, I'm specifically calling out Rosie's story here, but I want to recognise also the fierce and tireless advocacy of many victim survivors, both before that and post that time. Those who don't have a public profile, and, you know, there are a lot of unheard voices of victim survivors who've been advocating for change for a long time, including Aboriginal and Torres Strait Islander women. So I think it's important to acknowledge that. So the Royal Commission held a huge number of public hearings. The aim of the Royal Commission was to prevent family violence, improve support for victim survivors and hold perpetrators to account. Really important element, and I'll get to that a bit later. So watershed moment for the state. Government agreed to implement all 227 recommendations and originally invested $2.7 billion to support this happening. So I think there's no overstating the support of this, particularly from the Premier at the time, to implement the recommendations. And the changes we've seen are, of course, a direct result of all of this. So broadly speaking, I'd say the reforms have been really driven by the need to focus on lived experience of family violence and how the system can meet victim survivor needs. I think prior to the Royal Commission, even though in family violence there's a lot of lived experience in the practitioners and the workers who are doing that, this formalisation of survivor advocate roles, that really is a result of the Royal Commission, I think, and we've seen it now proliferate across the country. I think there was a really strong focus on intersectionality, cultural safety and meeting the needs of different communities. That really came out strongly in the Royal Commission, and of course self-determination for Aboriginal and Torres Strait Islander communities. We saw the embedding of a new portfolio, probably the first Minister for the Prevention of Family Violence here, and that's continued in Victoria, and obviously it's grown across the country. We also saw the creation of the Family Violence Reform Implementation Monitor. That was a very important oversight role because it really held everybody to account for the implementation of these reforms. So there are so many frameworks that sort of are guiding the work that's done here in Victoria, the main one being the Ending Family Violence Plan, the 10-year plan in Victoria. That includes the first 2 rolling action plans, and we're just about to do the 3rd one now. There's been a whole lot of work around workforce development, and there's an industry plan to support this, and we've seen 1 rolling action plan, the other is about to come out now. There's obviously been the Self-Determined Aboriginal Government Partnership through DELCHA, so that's been a big part of this. They have their own 10-year plan, and they've just released their 2nd rolling action plan. So you can see that this is very much overseen by lots of strategies and processes and programs. And then, of course, there's the prevention strategies and program, the primary prevention strategies and program. And these all exist and are trying to work alongside all the national frameworks that we have seen, including the National Plan to End Violence Against Women and Their Children and its action plans. Soon we'll see the first Aboriginal and Torres Strait Islander action plan, and of course the national prevention work changed the story. So, the reforms, what are the key important things that have come out? I think one of the biggest successes has been the Common Risk Assessment Framework, MARAM. It's the gel that binds, I guess, is the way I like to think about this. So it's a multi-agency and multi-level risk assessment management framework. It's been established in legislation, so under the Family Violence Protection Act 2008, meaning that organisations providing funded services relevant to family violence risk assessment and management are now legally required to align their policies, procedures, practice guidance and tools to the MARAM framework. Risk and safety planning, of course, is at the heart of specialist family violence practice. And it was interesting to listen to the Attorney-General talk about separation. And of course, we know post-separation is a high time of risk for those who are experiencing family violence. And I know many of you see this because you work in the post-separation area. But this is why risk and safety is really at the heart of the work that we do, particularly in the specialist sector. So the process of bringing key sectors to align with MARAM was crucial. It also means that services such as universal services, such as education and health, those that are a little bit more closely aligned to family violence, mental health and AOD services, now have a shared understanding of family violence risk and assessment to the extent that the sector needs to know. So not everyone needs to do the most comprehensive form of MARAM training, but those that work in the core do the most comprehensive, and then it slowly reduces as it gets out to at least being able to identify and refer. There are still many challenges we face in the alignment of specialist and universal services, particularly in the health and education sector, and the significant demand that is generated for services who work more at the specialist area from secondary consults, of course, that come from those universal services. So working through the challenges continues to be a key priority for us in the peak, but obviously all of you who do the work at the front line too. The other key issue that is really important is the information sharing schemes here in Victoria. So one of the key critiques that emerged from the Royal Commission was that important and critical information was not being shared between organisations working with victims and perpetrators and children of family that were experiencing family violence. And of course, the consequences of this can be catastrophic. It's interesting, I was just talking to Judge Harland about the importance of information sharing across jurisdictions too. So, it doesn't just sort of end at the state borders. So as a result, the Royal Commission recommended the creation of a family violence information scheme where authorised organisation and services would be able to share relevant information related to assessing and managing family violence risk. This scheme is also legislated under the Family Violence Protection Act, with authorised organisations and sectors listed as information sharing entities permitted to share information. Alongside this sits the Child Information Sharing Scheme, which allows authorised organisations to share information to support child wellbeing or safety. I think one of the challenges we found in the sector originally was the confusion between both schemes, when to use one or the other. But I think that this in part has been addressed now through the staged rollout. But it's interesting because I've spoken to some of the services who are involved in this work, some who are in the Orange Door, and Alison may speak more to this later. But we've still, I think, got to tackle the culture of information sharing in the sector. We still have people who are probably not sharing information to the degree that they're legislatively able to because of some of those hangovers from cultural concerns around privacy. So I think we've got a lot more to do in the cultural space, even though we have the enablers. The other big success, I think, of this reform, certainly my opinion, is the central information point. And that is a point where you can have access to information about perpetrators. Now, this is not to all services who operate in our system. It's the intake and the crisis services. So the Orange Doors, Safe Steps, which is our 24-hour 365 days, 7 days a week, however you want to describe it, service, and of course the men's referral services. I see Phil is here and you're going to hear from him as well later. They can get access to this, and this is really important because we know that there are a group of perpetrators who are repeat perpetrators with different survivors as well. So this information is really critical, and I think it's been a real game changer in our reforms. Again, we might need to think about how it's utilised and who has access to the information, but the enablers are there, which I think is really important. The reforms, of course, led to a broader legislative agenda around gender equality, and we've seen a whole range of things that have happened around that. And of course, at the Commonwealth level, we've just seen family violence leave implemented last year for all employees. So you can see that I think more broadly we're trying to really integrate this work into every kind of setting that we exist in around family violence. So that's been, I think, a really important development. I just want to talk about the Orange Door network because this is a really important part of the reforms. So I think one of the issues that was highlighted in the Royal Commission was the lack of streamlined entry points into the system. And specifically, the Royal Commission recommended the establishment of 17 support and safety hubs across the state, which are now known as the Orange Door Network. So there are actually 18 hubs though, because in the Wimmera region there are 2 due to the size of it. So the aim of the hubs was really to create a central point where people in the community could access family violence services, child and family services, and perpetrator or men service or people who use violence, however you want to describe it, under the same roof with a multi-agency risk assessment function and triage point for case management services. So despite being a significant focus of the Family Violence Reform Implementation Monitor, I think the implementation of the Orange Door, if I'm honest, has not been without its challenges, particularly around bringing together 3 distinct and different workforces together in the same area. And I think we're still working through how to deliver the best integrated services at that, in that area. Everyone's got really good will, and I'm sure we're going to get there, but it's an ongoing process. Of course, the Orange Door is not the only entry point for the family violence services. Or the vast children and family services, but the majority of work that we do have been seen in the Orange Door is family violence, about 60% of that. Complicating the Orange Door process, of course, is that it's actually managed by the Victorian government. So the services are partners in the Orange Door, but the hubs themselves are managed by the government through a partnership agreement. So some of these issues do create, sort of slight tensions, and we're still working through some of those things. And I think one of the other things we're seeing, and it'd be interesting to hear what some of the services who speak next have to say, is that obviously you open up the entry point, you're going to get demand, but the demand has to be funneled somewhere. So you also do need commensurate resourcing for the core services that actually accept the allocations from the Orange Door, and we're probably not there with commensurate funding for those services. And we've also, one of the other challenges this has presented, of course, has a huge expansion of workforce. So we need to staff the Orange Doors, we need to staff our home agencies. So this, of course, meant that we've actually experiencing quite a significant workforce shortage in this state. And that's also compounded, particularly for case management services, by the recommendation 209, which is basically that you must have a Bachelor of Social Work or its equivalent, or meet the equivalency requirements, and they are things like cultural knowledge or lived experience and some of those other things, but you must also work towards social work. So that's really hard to base, where you have limited social work graduates, to base a whole workforce on those requirements. So we're really thinking through now, what are some of the entry pathways that we really need to expand to get the workforce that we need. Some of the other big changes were things like refuge. Of course, we've seen a huge expansion of the refuge network, but also moving from communal to core and cluster. These are really important changes because before we had a lot of issues with families not wanting to go into refuge because the privacy issues in a communal refuge. So having this core and cluster model where there is some privacy for families, I think has been a huge winner for the system. And at the end of the building of all the core and clusters, we'll have about 35 refuges, 5 of which are Aboriginal-led. So I think even with all of that, we still have about 150 to 200 people or families a night in hotels. So you can see what the demand is huge. And I guess we need to think about other ways to manage this, including keeping women and children safe in the home. It's not always safe to do this, so we have to find a way to manage it. But I think with the housing crisis, what it is, and not being able to move people out of refuge quick enough, in Victoria, the waiting on the Victorian Housing Register for family violence being a priority is still 2 years. So, still and there's not enough transitional housing, there's not enough time-limited properties, what we call cap properties here too. So I think we need a bit more work around housing and how we move people on. So I want to talk a bit about people using violence in the justice system. So we've seen in Victoria an expansion of men's initiatives, men's behaviour change programs, voluntary and court mandated, as well as the introduction of case management, counselling and accommodation for men excluded from the home, and I think Phil will probably talk a little bit more about that. But we've tried to have some innovative approaches, so not just rely on men's behaviour change programs, and I think in this space we need to think harder and longer about what is working, what isn't working, do more of what is working, of course, and think of other innovative approaches. And it was good to see the 4-year funding in Victoria's budget for the people using violence work. We also, of course, have the adolescents using violence programs rolled out across both family violence and children family services. Some of you here may be providing those services here in Victoria. So that's a really good, I think, start as well. We also, in the justice space, we have 13 specialist family violence courts where criminal and civil issues like intervention orders can be heard together. So I think that's been a real development here, and there's been a lot of work with magistrates to develop that understanding around risk and to make decisions around protection, immediate protection for families. I think we should do more across jurisdictions, including with the family court. And I know a lot of you work more in the family court than I do, but to really develop some common understanding of family violence, how it impacts family, particularly when you're thinking about things like contact orders, post-separation and all of those really high-risk issues. And it was really great to see the Family Court hold the Family Violence Symposium recently. So I think, maybe there is a chance to sort of have more discussions and cross-jurisdictional discussions about that. Of course, primary prevention has been a big focus for Victoria. We've seen a lot of money invested in infrastructure like Respect Victoria. Even in the peak, we develop a statewide training program around primary prevention. We've seen all the work of the women's health services, like working locally and on the ground to deliver community-led primary prevention. So, and we have seen some small changes. We've seen prevalence slightly decrease in Victoria, so I think we're making some small changes. So I just want to talk a little bit moving forward and then I'll stop. So I guess what we're doing now is we're trying to move from design and implementation to measuring outcomes. What is our impact? Because we're going to really need to understand that to be able to make evidence-based cases for ongoing and sustainable funding across all areas. People using violence, people experiencing children, we need to really make sure that we know what is working. So we've got to really do some hard work around that. I think we're at a pivotal point in the journey now. This year, in the Victorian budget, was the first year we didn't see any growth. We did see the refunding of lapsing, though, which is a huge relief for many people, particularly with demands as it is. But we've also heard from the Premier that there'll be another package dedicated to violence, to this family and domestic violence and sexual violence, hopefully. So I think we're going to see, sort of this reinvigoration of oversight. This is really important because the system capacity and funding issues are critical here. We've got demand like I've never seen in nearly 22 years of working in and out of this sector, and I'm sure some of you work much longer than me and probably feel that as well. And we've also seen a record $4 billion invested by the state government into family violence. Now that's staggering and shows the commitment of this government. And I think while services are doing the best they can, it's still not enough to respond to the increasing demand and the need to keep people engaged. I've talked to some services about, the engagement of men using violence as they come in is not as high as it should be, and we really need the resources to follow up and make sure that they are engaged. We need tailored and prioritised responses for everyone who enters, including priority groups. We need to do so much more for children and young people. I don't think we've yet fulfilled the vision of the Royal Commission around children and young people. I think the new Children and Young People's MARAM might help us do that if we can somehow integrate the wellbeing aspects and have a really good tool that could be used across both sectors. I think that would be really helpful. And I guess we need to really think about long-term recovery for families, not just as they exit case management and leave them to whatever is out there. We need to really invest in ongoing support, therapeutic, financial, housing for families so that they can rebuild, heal and get back on, get on with their lives. And without access to housing and economic security, we're not going to see that. I guess I just want to say something about the federal government. Obviously, we've seen the announcement of the national plan to end violence against women and children. I think we probably haven't yet seen the states and territories and federal government come to an agreement about who is doing what under that plan. We've seen the state governments make announcements about what they're going to do, particularly in the crisis here. Not so much Victoria because they have had an ongoing commitment. But I just was looking at the federal budget last night. There's no funding for frontline services to help support families. There is, of course, support for ending violence payments, which is great. But a lot of people also then need ongoing support and management after that payment. They've got to go somewhere too. They need housing. And there's $1 billion in the budget for crisis and temporary and transitional housing that will take ages to build, and there is no operating money aligned with that. So that will fall back to the states and territories. So I think we need more budgeting where state and territories and the federal government have agreed between them who is doing what, and that is going to be so critical to whether or not that national plan is a success, I think, moving forward. So I might just stop there because I'm sure that there'll be many views and, questions from the audience, some of which I won't be able to answer, but I'll have a go.
Thank you, Tania, for sharing your insights into the Victorian experience. I know from Western Australia, while we do some great work in Western Australia, we certainly look to Victoria and the work that's been undertaken in Victoria, and certainly understand the workforce issues and not being able to have enough workers to fulfil the role. So hearing that you also have workforce issues and the demand that we all face is astronomical, I think, throughout the country, because we're not actually hearing the depth of FDV that people are experiencing, and we're not reaching and knowing and understanding the impact of the children, because you have to actually come to the attention of the police or child protection to be able to start counting people. So are there any questions from the floor that people would like to ask of Tania?
Hi, thank you so much. My name's Karen Bevan, I'm from Full Stop Australia, and I'm from New South Wales, where we run the New South Wales Sexual Violence Helpline and do work in this space. That was such a, it's just like the Cook's tour of Victoria. It was so helpful, thank you. I'm really interested, Victoria has done, the investment is incredible. We've all been following it with great interest, envy, and also keen to understand those learnings. You're in a situation now where this investment has been sustained. You've got Orange Door, you've got Marram, you've got significant investments, but still the demand is just not being met. How are you having that conversation with government? Because we're facing this in New South Wales, where people are saying, look, we've made some new investments, that should do it. And you're very ungrateful for not accepting that. How are you having that conversation, and what's the sort of context? I think your governance structure might assist you to have that in a respectful way. Just keen to hear about that.
Geez, I don't know if I'm going to have an edifying answer for you, but I think there are a couple of things. We've got really good foundations here in Victoria, but we've got some things that haven't happened which would be really helpful for the discussion. One is connected data systems. We can't see people traversing the system. So, for example, the Specialist Family Violence System has its own data system, which is the Commonwealth SHIP. I don't know if you're on SHIP as well. But the Children and Families are Chris or Iris, I can't remember. Iris, I'm not, anyway, both those exist, and then men's are on the other one, if it's Chris or Iris. So, and none of those are connected. So we can't really see where people are dropping out of the system yet. They're coming in, and I think they're coming in multiple ways. So maybe they're waiting somewhere and then trying somewhere else, because we have a no wrong door policy. You can go. You don't have to just go through the orange door. So I think that would really help us have that discussion. I think the other thing is reporting is still not as high as prevalence. And we've seen from the prevalence studies, this is a hugely prevalent issue out there. And we will never see reporting as high as prevalence. And that's why some of these homicides, they haven't even come to the attention of the system, because there are people experiencing this in isolation out there. So I think there is a few sort of interesting paths that we need to think about, so that we can have these discussions in kind of authentic and honest ways. And also, I think the other thing, Karen, is, and you might see this yourself, without proper recovery, we're seeing a lot of return visits. And I'm sure that's true in the men's, and I'm sure it's true in the children and families as well. We're not helping these families when they exit our system enough, and that's not, the services are doing the best they can, but there are so many system barriers. You can't get into other services, there's wait lists. You can't get a house, there's no housing. There's very little economic security, and I know that the government has increased single parents' subsidies, still not enough, nowhere near what is needed to help people recover. So we're just seeing a lot of re-entry. So I think we really have to work out impact. Where is the impact? Where are we having impact? How do we do more of it? And then start thinking about that. But I think what is really good about Victoria, and this is what I always say, we have opened the system. So we know what is wrong, right? So we can see what is wrong. We've got good foundations to correct it. So we've got to stay the course and move forward, because we can't go back now, because I think we know what's out there. We've got to really try and find a way to address it. And I think, that's why I think uncoordinated small announcements are probably not going to do that. I think what Victoria tried to do, we certainly are not there, we tried to do some transformative change. We tried to crack it all open, rebuild it, but there are some critical bits missing, and I think we have to work on those. I don't know what others who work in the system would say.
Thank you, Tania. My name is Nick Collins, and I'm Group Director of Client Services at Catholic Care Victoria, and we chair 15 FRCs, or I chair the network of 15 FRCs across Victoria. And one of the challenges we are seeing is, the reform's been great, but one of the biggest challenges between state and federal jurisdictions has been the information sharing provisions.
Yeah.
So in that context, what that means is we share information with DFFH, but they do not necessarily share that back with us.
Yeah.
And what that means in pragmatic terms is that mum might act protectively, leave her partner, and then a few months later they presented our services, and we contact DFFH and we say, what are the parenting arrangements? And they say, we can't share information with you. Because it only goes one way, not backwards and forwards, because we're not legally prescribed. Some of the FRSP services are not legally prescribed, but so we're chasing that up as an issue, and it's something that's been raised, but it's still very problematic.
Yeah, it's such a really critical program. I think it's the same in the courts we were just saying about. But I think there is, because of federation, of course, and the way in which states and territories work with the federal government, there's no kind of provision to do that. I do know, since we've seen this latest media and homicide, the media around the homicide, there has been discussion about whether or not we do need a national information sharing scheme. I'm not sure how that would happen. I'm not sure how legally that would happen, but there has been heaps of discussions about that, things like national risk assessment frameworks, national information sharing. I think for a long time police agencies have been working to register IVO, what we call here family violence intervention orders, what others call apprehended violence orders. They've been trying to register them so they can be acknowledged in each state, and they still haven't managed to do that, So I think there are so many things that need to happen to facilitate that working. But yeah, I don't think I've got a good answer for you, but I do know the national schemes have been the centre of discussions, certainly the ones that I've been part of, in the last wee while. So it'll be interesting to see if anything comes of that.
What we've tried to do is go around the back door in relation to those sorts of issues. So in some instances we've been able to get some really good information sharing, but it's sort of on a case-by-case basis. You have to escalate to really get to that level. But anyway, so I think there is some movement now in light of what's happened.
I get it, because someone's life's got to be kind of almost immediately in danger, and in family violence it's sometimes hard to make that call.
G'day, it's Angela Lynch. I'm here from the DV Alert program, but I'm also the Executive Officer of Queensland Sexual Assault Network. I was interested in your statements around the justice system and the work that are being done there. I'm asking in particular in relation to the criminal courts. So rather than just the protection order courts or the domestic violence protection order courts, so in Queensland the district court that sees the bulk of the criminal court matters. So what work has been done there with those judges, those issues around risk, which has just been highlighted by obviously the horrific murder of Molly Ticehurst, and sort of alerting that system in relation to evidence of risk? Does MARAM get before those judges in relation to determining risk and things of that nature, or just what work has been done, not at that magistrates court level, but that higher level, and whether it may not have? I'm just interested.
Angela, I can't answer that, to be honest. Our version of your district is the county court. They have been far more involved in the sexual assault work, but I don't know to what degree they have been. It's been a lot of my engagement has been with the Magis court.
Thank you.
No worries.
Thank you. Unfortunately, that's all we have time for at the moment, so please join me in thanking Tania for her great presentation today.